Hello and welcome to today's review. Today we will be looking at the common medical surgical nursing questions that were tested between the period January to April 2025. The first question was, a nurse discovers that an IV site in a client's hand has infiltrated, causing localized pain and swelling. Which intervention will relieve the client's discomfort most effectively? Looking at nurse A up to nurse D. Nurse A is the one that is doing a wonderful job here. The limb should be elevated and also should be wrapped in a warm towel. Doing so, especially elevating the arm, will promote venous drainage and venous return to the heart and will reduce edema. Applying warmth, this one normally increases circulation and will ease pain and edema. Ice application will relieve pain but not edema, and that's why it might not be a correct option in that case. Using of analgesic wouldn't correct the primary cause of the discomfort, and wrapping the arm above the hand will slow the venous return and is therefore contraindicated in this case. A nurse is assisting the healthcare provider with the removal of a central venous access device. What should the nurse do to prepare the client? From nurse A to nurse D, and nurse D is doing a great job. Instruct the client to take a deep breath and hold it. The client should be asked to perform the Valsalva maneuver, and in this case, they'll be told to take a deep breath and hold it during the insertion and also the removal of this CVAT. So this action normally increases the central venous pressure during the procedure and will help prevent air embolism, which is an emergency. In terms of positioning, Trendelenburg is the preferred position for CVAD insertion and removal. If not possible, a supine position will be sufficient for the CVAD removal. The client should hold their breath and not exhale, and that makes that option wrong. The nurse reviews the lab results of a child with leukemia. Which action should the nurse include in the plan of care? Looking at option nurse A up to nurse D, the nurse needs to restrict staff and visitors with active infections. The child's neutrophil count is low, and this is going to predispose the child to an infection. If an infection occurs, the child will have difficulty combating it. Therefore, staff and visitors should be restricted to those without should be restricted to those without an active infection. Typically, neutropenic precautions will be used to protect the child from the exposure to the infections. The hospitalized child will be placed in a private room with visitors and staff screened for the illness. Temperature will be monitored every 4 hours. Low neutrophil count do not increase the likelihood of vomiting, therefore an antiemetic is not needed. Increasing the child's oral fluid intake may be necessary, however, doing so is unrelated to the child's neutrophil count. The nurse is assessing an adolescent who has been diagnosed with aplastic anemia. Which should be the priority assessment for the nurse? Aplastic anemia. Look for the signs and symptoms of an infection. Aplastic anemia normally results from lowering of all blood cell counts, causing an adolescent to be neutropenic. Neutropenia often leads to infection, which can be life-threatening, so this is the priority assessment for the nurse. Decreased cardiac output from septic shock is a real threat. Nutritional deficits are difficult to correct where the client is acutely ill. Electrolyte imbalances and weaknesses do not occur with pancytopenia and acute illness in the hospitalized child. They are corrected on a daily basis and are considered urgent when effects such as arrhythmias are likely. An adolescent should be independent in self-care activities whenever possible, but this is a low priority for a client who is ill. A nurse has a custody of a client's daily cardiacs and care plan, so in order to give a change of shift report. After reporting to the next shift, what steps should the nurse implement to maintain client's confidentiality? They need to shred the documents or place them in a container to protect client's confidentiality. Codexes and care plans and other client documents contain confidential client information. The nurse should shred them or place them in a special confidential container for proper disposal. Regular garbage isn't secure and isn't an appropriate place to dispose of documents containing a client's name and information. Equally, leaving those documents at the nursing station may allow others to view them. It isn't necessary to place the nursing codex and the care plan in the client's chart when the nurse has finished using them. The nurse is monitoring a client who is 6 hours post embolectomy for an acute arterial occlusion of the left leg. When a Doppler ultrasound fails to detect a pedal pulse, the nurse notifies the surgeon who requests that the client be prepared for immediate surgery. The client refuses to consider additional surgery. What is the nurse's initial intervention? They need to notify the healthcare provider immediately. The healthcare provider is responsible for providing information regarding the procedure, risks, benefits, and expected outcomes. After notifying the healthcare provider, the nurse should document the situations and the client responds in the client's record. A nurse is caring for clients on a medical surgical unit. Which client should the nurse see first? So this is just prioritization. Find that a 60-year-old client admitted with partial thickness with a second-degree burns covering the arms, chest, neck, and face should be considered first because these burns covering the upper body is the most at risk for airway complications and should be assessed first. The postoperative gland with low-grade temperature should be assessed next. Although temperature elevations are common postoperatively, the fact that this gland is only 48 hours post coronary artery bypass makes this assessment the next highest priority. The nurse should assess the client awaiting cholecystectomy. Chills are common when cholecystitis is present, but because the client has a procedure pending the next day, the nurse needs to ensure that the client has no acute changes that need to be addressed. Finally, the client with hypertension and dizziness should be assessed. An elevated pressure in this range is not urgent. Which gland is most at risk for developing acute lymphocytic leukemia? A 4-year-old white female. Acute lymphocytic leukemia is most common in young children and in adults aged 65 and older. It's more common in whites than blacks or Asian, and that makes the correct answer. A client with peptic ulcer disease is ordered aluminium magnesium complex. When teaching about this antacid preparation, the nurse should instruct the client to take it with antacid. Yeah, take it with water. Nurse should instruct the client to take the antacids with water because water helps transport antacid to the stomach. The client shouldn't take an antacid with fruit juice or a food rich in vitamin C or D because antacids may impair absorption of important nutrients in the juice or food. When completing the preoperative checklist on the nursing unit, the nurse discovers an allergy that the client has not reported. What should the nurse do first? Unreported allergy, you inform the anesthesiologist. The anesthesiologist is the one who administers the anesthetic agent and monitors the client's physical status throughout the surgery, and they must have knowledge of all known allergies for client safety. The completed record with preoperative checklist must be available to all members of the surgical team, and any unusual last-minute observations that may have a bearing on anesthesia or surgery are noted prominently at the front of the medical record. The pre-anesthetic medication can cause lightheadedness or drowsiness. The nurse in the scrub role provides sterile instruments and supplies to the surgeons during the procedure. A client with a history of cardiac problems reports severe chest pain. What should be the nurse's first response? You need to assess the client's pain assessment should be the first one. The nurse's first response is to further assess the client's pain. After thorough assessment, additional appropriate actions may be to notify the healthcare provider, administer analgesic, and administer oxygen. What is the most common assessment finding in a child with ulcerative colitis? Ulcerative colitis, we have profuse diarrhea, intense abdominal cramps, anal fissures, and abdominal distensions are more common in Crohn's disease than ulcerative colitis. A nurse is caring for a client who has a chest tube inserted 12 hours ago for treatment of pleural effusion. Which assessment is the most important in determining the client's response to treatment? Client verbalization of decreased dyspnea. Once some of the fluid has been removed via the chest tube drainage system, the client should feel relief and have a decrease in dyspnea. Serous fluid and bubbling in the water-sealed chamber are normal findings with the insertion of a chest tube, but do not indicate how the client is responding to the treatment. The nurse assesses the client who has had a partial gastrectomy, has a decreased hemoglobin and hematocrit. The nurse explains to the client that the partial gastrectomy has most likely contributed to which deficiency? B2 deficiency. This is the extrinsic factor combines with the intrinsic factor, a substance secreted by parietal cells of the gastric mucosa, forming a hematopoietic factor. Hematopoietic factor stimulates erythropoiesis. A decrease in vitamin B12 absorption, such as caused by partial gastrectomy, normally results in anemia. A postoperative client has exhibited decreased urine output, hypotension, and tachycardia. Which nursing assessment is the priority? Postoperative has exhibited decreased urine output, hypotension, and tachycardia. Check the dressing, right? Check the dressing. Although all the assessment that may be indicated for this client, the priority one is dressing. The client is exhibiting signs of shock. So shock is a postoperative client. In a postoperative, typically results from bleeding. What is the appropriate nursing goal for a client who has ulcerative colitis? You'll verbalize the importance of small, frequent feedings. These feedings are better tolerated by clients with ulcerative colitis as they lessen the amount of fecal material present in the gastrointestinal tract and decrease stimulation. The client does not need to maintain a daily record of intake and output unless an exacerbation of the disease occurs. A heating pad should not be applied to the intestines as it is inflamed. If it is not inevitable that the client will require surgery to treat the ulcerative colitis, as about 85% respond favorably to conservative management. If the severity of the disease mandates surgery, the colon will be removed, resulting into an ileostomy. A 29-month-old child who is hydrated as a result of vomiting requires oral rehydration. Which concept regarding oral rehydration therapy should the nurse consider? Need to give 1 to 3 teaspoons. That's about 5 to 15 mils of fluid every 10 to 15 minutes. Giving small amount of fluids at frequent intervals is the first action a nurse should take when the child is vomiting. Doing so allows the nurse to observe the child's tolerance level. Simple sugars aren't good source of hydration because of their osmotic effects. The nurse shouldn't wait 72 hours before taking action if a child is vomiting or has diarrhea. Toddlers can become dehydrated in a short time. A healthcare provider should see a child whose vomiting or diarrhea persists for 24 to 36 hours. Wet diapers are a good source of determining hydration. However, 3 wet diapers each day isn't normal finding for toddlers. A hydrated toddler should have 6 to 8 uh, diapers per day. A client with hypertrophic cardiomyopathy is experiencing dyspnea, chest pain, syncope, fatigue, and palpitation, and has an apical systole thrill and a heave, fourth heart sound, S4, and systolic murmur. Which nursing diagnosis should the nurse use to guide the patient care? Hypertrophic cardiomyopathy, decreased cardiac output will be the appropriate nursing diagnosis for a client with hypertrophic cardiomyopathy because the hypertrophied cardiac muscles decrease the effectiveness of heart's contraction, decreasing the cardiac output. Heart failure may complicate this condition, causing fluid volume excess. Therefore, the nursing diagnosis of risk for deficient fluid volume is not applicable. Ineffective tissue perfusion will be applicable if the client is experiencing an alteration in peripheral tissues, that is, capillary refill greater than 3 seconds, or a change in skin's characteristics. Although it might seem that the diagnosis of risk for activity intolerance will be applicable because of dyspnea and fatigue, addressing cardiac output will help reduce these symptoms. Which source of information helps nurse formulate nursing diagnosis for a client with a specific client? You need essential assessment data. Right? The nurse formulates nursing diagnosis after completing assessment or assessment or data collection step in the nursing process. Analyzing essential assessment data and identifying the specific signs or symptoms and probable cause help the nurse diagnose the client. Research articles provide information related to developing current intervention, but they don't help the nurse formulate nursing diagnosis. The nurse formulates outcome criteria after, not before the nursing diagnosis. Admission criteria may help them formulate the nursing diagnosis, but won't do so without the essential assessment characteristics. A client is admitted for an exacerbation of irritable bowel syndrome who insists on being allowed to keep a head covering on at all times. What's the best response by the nurse? Please help me understand this practice. The nurse should demonstrate respect for the client's request. Asking the client to explain the need for this practice in the hospital will lead to a discussion where a reasonable solution can be determined. Demanding that the client explain why this is so important is antagonistic and disrespectful. Resorting to standard responses such as the hospital policy or the infection control presumes judgment and no room for discussion. These responses are also disrespectful. Guys, a link will be popping up also on therapeutic communication. A client was admitted to the hospital because of transient ischemic attack, TIA, secondary to arterial fibrillation. The nurse anticipates that the provider will prescribe warfarin, warfarin sodium. Atrial fibrillation may lead to formation of mural thrombi, which may emboli into the brain. Warfarin sodium further prevents clot formation and prevents clot enlargement, so they is a blood thinner. The other drugs used in the treatment and control of atrial fibrillation but won't affect clot formation. An epidemic of ASAS, severe acute respiratory syndrome, is occurring in a community of 10,000 people. 3 people are being admitted to the emergency department. 2 people are vomiting. Which type of precaution should the nurse institute? Airborne precautions. Transmission of the SARS and other diseases such as the COVID-19 that are transmitted by respiratory route can be contained by a full airborne precautions, which includes an isolation room with a negative pressure, use of an N95 respirator, and the use of personal protective equipment. The disease is spread by respiratory, not enteric route. Hand washing alone is not sufficient to prevent transmission. Reverse isolation, that is protecting the client, is not sufficient to prevent a transmission. A client infected with HIV has a low CDF. What intervention should the nurse implement? Low CDF, place the patient in reverse isolation. CD4 levels in blood of an individual with HIV infections determine the extent of damage to the client's immune system. The test indicates the individual's risk of an opportunistic infections but does not identify specific infection. Viral loads and resistance to specific antigens are determined by using other diagnostic tests. Because of the client's risk, isolation is recommended. A client must administer an enema to an adult client. The appropriate depth for inserting an enema into an average-sized adult is 3 to 4 inches. The appropriate depth for inserting an enema is about 3 to 4 inches. A client has deep venous thrombosis in the right leg. What should the nurse instruct the client to do? Keep the right leg elevated above the heart level. The extremity should be kept elevated with the heart applied to treat the inflammation and the pain. To decrease the chances of dislodging a thrombus, the client typically kept on a bed rest during the initial stages of treatment until therapeutic levels of anticoagulation are achieved. The client may exercise the unaffected leg, but not the one with deep venous thrombosis. Assessing the edema of the right is essential activity, but it is the responsibility of the nurse to perform these tasks. A client is receiving captopril for heart failure. The nurse should notify the healthcare provider that the medication therapy is ineffective if an assessment reveals a peripheral edema. Peripheral edema is a sign of fluid volume excess and worsening heart failure. A skin rash, dry cough, and postural hypotension are adverse reaction to captopril, but they don't indicate that the therapy is ineffective. A client's laboratory results indicate hypokalemia, hyperglycemia, and increased white blood cell count. Which newly prescribed medication should the nurse associate as the most likely to contribute to these changes? Hypoglycemia, hypokalemia, increased white blood cell. Prednisone. Many of these medications listed can contribute to hypokalemia including prednisolone, which is a corticosteroid, albuterol, which is a short-acting beta-2 agonist, and furosemide, which is a loop diuretic. Fluoroquinolone antibiotics such as ciprofloxacin can cause hyperglycemia as prednisolone and albuterol. However, only prednisolone can be linked to hyperglycemia, hypokalemia, and increased white blood cell count. The elevation in white BCs with corticosteroid use is primarily due to anti-inflammatory effects, which result in decreased adhesion of the neutrophils to the endothelium and associated increase in number of circulating in the blood. It is not an indication of an infection related to immunosuppressive acts of the drug. A client has had a left chest tube in place for several days. The nurse assesses the client and notes that there is no bubbling in the water seal chamber. Auscultation of the left lower limb reveals vesicular breath sounds. What is the most appropriate action by the nurse? You need to further assess the gland for reinflation of the lung. Lack of bubbling in the water seal chamber under normal sounds are an indication of the lung reinflation has just occurred. So the nurse can further assess the gland in relation to pulse oximeter, respiratory rate, and other signs that indicate improvement and can be relayed to the healthcare provider for possible removal of the chest tube. A client with the diagnosis of a respiratory acidosis is experiencing renal compression. What function does the kidney perform to assist in restoring acid-base balance? Respiratory acidosis. Yes, retaining the bicarbs to the body's circulation. The kidney performs two major roles to assist in acid-base balance. The first one is to reabsorb and return to the body's circulation any bicarb from the urinary filtrate, and second is to excrete excessive acid in urine. Retaining bicarbs will counteract an acidotic state. The nephrons do not sequester free hydrogen ions. A client with atrial fibrillation is prescribed warfarin. What should the nurse explain the purpose of this medication is? Warfarin is prescribed to people with atrial fibrillation to reduce the risk of having a stroke. Warfarin prevents vitamin K from synthesizing certain clotting factors and is used to reduce thrombi formation in the atria of people with atrial fibrillation. This reduces the risk of stroke. Warfarin and other anticoagulants do not alter the viscosity of blood despite their being commonly referred as blood thinners. Warfarin does not alter the rhythm associated with atrial fibrillation. Warfarin does increase the client's risk for bleeding, but this is a side effect, not the purpose of the drug. Which client diagnosed with pneumonia is likely to have a community-acquired pneumonia? Community-acquired pneumonia. Well, this could be a client who is newly admitted in the long-term care facility, right? The client who is new in a long-term facility is at high risk of community-acquired infections. Traveling is not likely to cause community-acquired pneumonia. Legionnaires' disease is a risk if traveling on a confined cruise ship. Receiving family visits and the death of a spouse are not typically causative factors associated with developing community-acquired pneumonia. A nurse is caring for a child who is one day post-op after having a colostomy. The parents are concerned that the stomach has not drained any stool. What should be the appropriate response by the nurse? It may take several days before the stomach to function. Effluent from fecal stomach may not resume for several days, usually 24 to 48 hours upon return of the bowel sounds. While the absence of the stool from a fecal stomach is not a medical emergency, the absence of urine from an incontinent urinary stomach represents a medical emergency that must be promptly reported to the surgeon. A nurse is caring for a 4-year-old with end-stage leukemia. The child's healthcare provider has ordered a lumbar puncture. The child's female parent, who has legal custody, has refused to give consent for the child to undergo the procedure. However, the child's male parent is demanding that the procedure be performed. What should the nurse do? Need to inform the male consenting parent that the procedure won't be performed because the female parent who has legal custody didn't consent. The parent who has a legal custody of a child has a medical decision making rights for that particular child. The other parent could contest the decision but will need to seek the legal counsel. After informing the male partner that the procedure won't be performed at this stage, the nurse should take the healthcare provider and health service aware of the situation in the case of additional problems arising. A client who recently had a stroke requires a cane and to ambulate. When teaching about the cane use, the nurse should explain that the reason for holding a cane on the unresolved side is to distribute the weight away from the involved side. Holding a cane on the uninvolved side distributes weight away from the involved side. Holding the cane close to the body prevents leaning, and using a cane won't maintain a stride length or prevent edema. A client comes to the clinic with a back pain that has been unrelieved by continuous ibuprofen pressure over the past several days. Current prescription medications include captopril, hydrochlorothiazide. Which laboratory value should the nurse address? BUN of 26 and serum creatinine of 2.35 milligrams per deciliter. NSAIDs can increase the antihypertensive effect of ACE inhibitors and predispose client to the development of acute renal failure. Common lab tests used to evaluate how well the kidneys are working are BNU, creatinine, and creatinine clearance. Labs such as sodium, potassium, CPK, and white BC levels will not provide information on the renal function. The nurse is teaching the parents of a child with sickle cell disease. What information should the nurse give the family on how to prevent sickle cell? You need to be able to drink at least 8 cups, about 2 liters of fluids per day. Increasing the fluid intake and being well dehydrated will help prevent stasis and stasis in the small intestines. Restricting fluids causes stasis of red blood cells and promotes obstruction and increases the chance of sickling with hypoxia and pain in the part that is involved. Clients with sickle cell disease should avoid exercising in cool temperatures or swimming in cold water. While contact sports are not recommended because of the bleeding risk, they should not cause sickle cell crisis. Taking anti-inflammatory medications before exercise does not prevent sickle cell crisis. When planning care for a client with a small bowel obstruction, which should the nurse consider to be the primary goal? Need to maintain fluid balance, because a client with a small bowel obstruction can't tolerate oral intake. Fluid volume deficits may occur and can be life-threatening. Therefore, maintaining fluid balance is the primary goal. Pain relief and maintaining body weight don't reflect life-threatening conditions. Ambulation will not be a priority because nasogastric sanctioning and pain control. The nurse is teaching a client to deep breathe effectively after a lobectomy. What should the nurse include the gland to do. Contract the abdominal muscles, take a slow breath through the nose, hold it for 3 to 5 seconds, then exhale. The recommended procedure for teaching glands postoperatively is to deep breathe, which includes contracting the abdominal muscles and taking a slow, deep breath through the nose. This breath is held for 3 to 5 seconds, which facilitates alveolar ventilations by improving the inspiratory phase of ventilation. Exhaling slowly as if trying to blow out a candle is a technique used in pursed breathing to facilitate exhaustion in glands with chronic obstructive pulmonary disease. It is recommended that the abdominal muscles be contracted, not relaxed, to promote deep breathing. The gland should breathe through the nose. A nurse is caring for a client who reports dyspnea while resting or as 5 on a scale of 1 to 10, has a respiratory rate of 26, and exhibit oxygen reserve of 96 on room temperature. Based upon the findings, what outcome should the nurse incorporate in the plan of care? The client's resting dyspnea is level 4, and the client's breathing rate is 12 to 20 breaths per minute. The nurse plans outcomes that are specific and measurable where possible and that reflect an improvement in the condition that is achievable in the given time frame. Since the reported problems are dyspnea while resting at 5 on a 10-point scale and an elevated respiratory rate, the outcome that identifies a lower dyspnea score and decreased respiratory rate is appropriate. In this case, there is no mention of adventitious breath sounds being present, so they should not be identified in the outcomes. The gland's dyspnea was measured at rest, so it should not be compared to dyspnea with activity, which would have been a different rating. The initial room temperature of saturation is 96, so an outcome of 92 does not reflect stability or improvement in the gland's condition. The nurse is developing a care plan for a nurse with tuberculosis. What measures should be implemented for the nurse prior to entering the room? They should wear mask all times when entering the room. Special mask that N95 that provides passage that prevents the passage of airborne droplets is needed to intercept airborne droplet transmission. This choice represents the use of transmission-based precautions specifically to prevent the spread of tuberculosis. Gowns and gloves are not required. Visitors are welcome provided they wear a mask during their visit to protect themselves. A nurse is teaching a client with emphysema how to perform past lip breathing. The client asks the nurse to explain the purpose of this breathing technique. Which client should the nurse provide? Past lip breathing. It helps prevent early airway collapse. Past lip breathing helps prevent early airway collapse. Learning this technique helps the client control respiratory uh, during periods of excitement, and we have also anxiety, exercise, and respiratory distress. To increase inspiratory muscle strength and endurance, the client may need to learn inspiratory resistive breathing. To decrease accessory muscle use and thus reduce the work of breathing, the client may need to learn diaphragmatic breathing, that's abdominal breathing. In past lip breathing, the client mimics the normal respiratory rate in inspiratory expiration, 1:2. A client with emphysema may have as a high ratio of about 1:4. A client diagnosed with tuberculosis is taking prescribed chemotherapy of isoniazid, rifampicin, and pyrazinamide. Although the side effects are rare, the nurse should assess the client for which of the following side effects in this combination. Hepatotoxicity. The major side effect of these drugs is hepatotoxicity. While the client is taking this medication, the nurse should carefully monitor the client's health. Ototoxicity and nephrotoxicity are side effects of, of other drugs used to treat TB, such as tuberculosis for the streptomycin, kanamycin, and capromycin. Optic neuritis can be a rare side effects of isoniazid. A client is to be discharged with a prescription for lactulose. The nurse teaches the client how to administer this medication, which statement indicates that the client has understood the information. I will mix it with apple juice. The taste of lactulose is a problem for the client, so mixing it with fruit juice, water, or milk can make it more palatable. Lactulose should not be given with antacid, which may inhibit its action. Lactulose should not be given with a laxative because increased stooling is an adverse effect of this drug and will be potentiated by using a laxative. Lactulose comes in a form of a syrup for oral or rectal administration. So the other short answer questions were questions like explain the CAB assessment, you explain 4 types of cardiomyopathies, clinical manifestation of meningitis, forms of sickle cell crisis, 8 priority nursing intervention of client with decreased white BCs, differentiating right and left heart, a multiple of myeloma, procedure performed to monitor respiratory status, the nurse interventions to patient to prevent to a patient scheduled with for barium swallow, and lastly clinical manifestation for a child with pneumonia. When we have the CAB assessment, the CAB scoring system helps assess the severity of community acquired pneumonia to guide treatment decisions, and this includes like the mnemonic. When you look at C stands for confusion, and this could be onset of new onset of disorientation or altered mental status. Age, look at anybody above 60 or equal to 65 years old. There is always a higher risk for complication for this group. Blood pressure of less than or equal to 90/60 millimeters of mercury. Hypertension could indicate severe infection. Respiratory rate of equal to 30, greater than or equal to 30 breaths per minute. Tachypnea could suggest respiratory distress. Blood urea nitrogen of values of greater than or equal to 7 millimole per liter could be signs of dehydration, organ dysfunction. So if you get a score of between 0 to 1, that points to outpatient treatment. If you get 2 points out of the points that we have here, you could be considered for hospitalization. And if you get more than 3 points, this patient requires hospital administration. And sometimes ICU may be required if it is so severe. You're supposed to describe types of cardiomyopathies. We have several. We have the first one is dilated cardiomyopathy, and here is where heart chambers do enlarge, reducing the pump efficiency. Example could be the alcoholic cardiomyopathy. Dilated cardiomyopathy is the most common type and leads to heart failure and arrhythmias. It can be caused by genetic mutations, infections, or toxins like alcohol. Hypertrophic cardiomyopathy. This one is characterized by abnormal thickening of the heart muscle, restricting blood flow. Example could include genetic hypertrophic cardiomyopathy, and hypertrophic cardiomyopathy is the leading cause of sudden cardiac death in young athletes. It's often associated with left ventricular outflow obstruction. The third type of cardiomyopathy is restrictive cardiomyopathy. Here, heart muscles become stiff, impairing feeling. Examples include the amyloidosis-related cardiomyopathy. It is the least type of the three and primarily affects diastolic function. It can result from fibrosis or infiltration of abnormal proteins. The fourth type is arrhythmogenic right ventricular cardiomyopathy. Here is where we have fatty tissue replacing right ventricular muscle, causing arrhythmias. Examples include the arrhythmogenic right ventricular cardiomyopathy in young athletes. It has a strong genetic component linked to desmosol mutation. It can cause sudden cardiac arrest, especially in physically active individuals. Lastly, we have the Takotsubo cardiomyopathy is also referred to as a stress-induced cardiomyopathy or broken heart syndrome. The cardiomyopathy is associated with hard work, stress, and overexertion, and this is common among people from Japan. It is also one of the conditions that the former deputy president, the second deputy president of Kenya, was diagnosed of after the or during the impeachment, the famous impeachment process. The four major clinical manifestations of appendicitis includes periumbilical pain, which shifts to the right lower quadrant. This is the right lower quadrant is what we normally refer to as the McBurney's point. We also have rebound tenderness, where pain increases when pressure is released. Patient can also present with nausea and vomiting, which often follows pain onset. We also have fever and leukocytes, where we have elevated white BC's count indicating an infection. We also have the Rev sign, the Revis sign. And what is the Rev sign? The Rev sign is the pain in the right lower quadrant when palpating the left lower quadrant. Lastly, we have the psoas sign, which is pain associated with passive extension of the right hip, indicating rectosical appendicitis. Four forms of sickle cell crisis. We could talk of vaso-occlusive crisis, where we have blocked blood flow leading to severe pain. Number two, we could talk of the aplastic crisis. This is bone marrow suppression, reduces RBC production. Hemolytic crisis, where we have rapid destruction of RBCs leading to severe anemia. Sequestration crisis, where we have pooling of RBCs in the spleen causes hypovolemic shock. Then we have hyperhemolytic crisis. Excessive hemolysis causes severe anemia and jaundice. And lastly, we have acute chest syndrome. This is life-threatening conditions with fever, chest pain, and respiratory distress. Priority nursing intervention for a patient with decreased white BC. We implement strict infection control precautions. You monitor temperature frequently for signs of infection. You administer antibiotics as prescribed. You also encourage the proper hand hygiene for the patient and caregivers. You provide a neutropenic diet. So in this case, you avoid raw food and unpasteurized products. You limit number of visitors, limit the visitor contact to prevent also infections. Administer colon stimulating factors like the filgrastim if prescribed. Monitor CBC to assess white BC trends. Encourage oral hygiene with antiseptic mouthwash to prevent infections. And educate the patients on avoiding crowded areas and sick patients. Difference between the right and left ventricle. You have the right, that is heart failure. The right heart failure is caused by pulmonary hypertension and chronic obstructive pulmonary diseases like COPD, while left heart failure is caused by hypertension and ischemic heart diseases. The main effect of right heart failure is systemic congestion, whereas the left heart failure leads to pulmonary congestion. Next, patients with right heart failure presents with symptoms such as peripheral edema, ascites, jugular vein distension, while those with left heart failure experience dyspnea, orthopnea, and pulmonary edema. Right heart failure affects the liver, leading to hepatomegaly, while left heart failure primarily affects the lungs, causing pulmonary crackles. Additional features of the right heart failure includes weight gain due to fluid excitation, while left heart failure is associated with nocturnal dyspnea and pink frothy sputum. Diagnostic tests reveal elevated central venous pressure, CVP, in the right heart failure and elevated pulmonary capillary wedge pressure in the left heart failure. Pathophysiology of multiple myeloma. This is normally result from uncontrolled proliferation of plasma cells in the bone marrow. So we have abnormal monoclonal immunoglobulins, those ones that we refer to as M proteins, will be produced leading to immune dysfunction. Osteolytic lesions will develop due to increased osteoclast activity, causing bone pain and fractures. Bone marrow suppression leads to anemia, leukopenia, and thrombocytopenia. Renal damage occurs due to protein deposits. Hypercalcemia develops due to bone destruction, leading to fatigue and confusion. Increased risk of infection due to impaired normal antibody production normally results. Some of the diagnostic procedures for monitoring respiratory status, we could do ABGs, arterial blood gases analysis. We evaluate oxygenation and acid-base balance. Could also use a pulse oximeter where we measure oxygen saturation levels non-invasively. Also chest X-ray to detect pneumonia, effusions, and lung collapse. Spirometry, those are the pulmonary function tests. This one will help assess lung volumes and airflow obstruction. Peak expiratory flow rate, this one will measure air obstruction severity in asthma and COPD. Lastly, we could talk of bronchoscopy, which is direct visualization of the airways to diagnose infections and tumors. Nursing intervention for a patient scheduled for a barium swallow. Ensure fasting for about 6 to 8 hours before the procedure. Explain the procedure to reduce anxiety. You also assess for allergies to barium contrast. Encourage fluid intake post-procedure to prevent constipation. Monitor for signs of barium impaction, delayed stooling, and abdominal pain. Educate the patient about temporary white stools after the procedure, and position the patient properly during the procedure. You ensure the patients avoid smoking before the test. This one will reduce interference with imaging. Provide a mild laxative post-procedure to facilitate barium elimination, and also monitor for signs of aspiration if the patient has swallowing difficulties. For clinical manifestation of pneumonia, patient could present with cough, with purulent or rust-colored sputum, fever and chills due to infection, dyspnea and tachypnea from impaired gas exchange, crackles and decreased breath sounds on auscultation, pleuritic chest pain, that is sharp pain worsening with deep breathing, cyanosis, which is a late sign indicating severe hypoxia. Some of the long questions included Mrs. XE, 30 years old woman, presents with complaints of night cough and wheezing. The client is admitted for nebulization with Ventolin. We're supposed to identify 5 priority nursing diagnoses for this client. You outline the pathophysiology of the condition above. You describe diagnosis of this condition and state the priority drugs that can be used to manage asthma. Another one is concerning bleeding. You are requested to explain types of coagulation disorders and describe any 5 diagnostic test used for diagnosis of disseminated intravascular coagulopathy? The other question is Mr. Y, 42 years old man, presents with chronic productive cough. He is then admitted to the hospital with a diagnosis of bronchoectasis. Identify 5 priority nursing diagnoses for this client. This outline the pathophysiology of bronchoectasis. You describe the diagnosis of this condition and describe the collaborative management that will be used to manage bronchoectasis. Lastly, concerning anemia, you explain the 5 types of anemia. You describe any components of a complete blood count report. So priority diagnosis related to asthma, we could talk of infective airway clearance related to bronchoconstriction and mucus production. We could also talk of impaired gas exchange related to ventilation perfusion mismatch, ineffective breathing pattern related to increased airway resistance, anxiety related to dyspnea and fear of suffocation, risk for ineffective therapeutic regimen management related to lack of knowledge about asthma triggers and medication use. In terms of pathophysiology, asthma is a chronic inflammatory disorder of the airway. So exposure to triggers like allergens, the cold air, exercise can lead to airway inflammation and hyperresponsiveness. Inflammatory mediators like histamine, leukotrienes, they cause bronchoconstriction and increase mucus production and airway edema. All these changes could lead to obstruction, causing symptoms like wheezing, coughing, and dyspnea. If left untreated, asthma can lead to chronic airway remodeling, which could lead to an irreversible obstruction. In terms of diagnosis, we could do history and physical examination where we could notice some symptoms of wheezing, cough, night cough, and dyspnea. We could also do pulmonary function test, especially spirometry, where we are going to notice the reduced forced expiratory volume in 1 second vis-a-vis forced volume, vital capacity, and with the ratio that we have, this ratio will be reduced, but it will have another trait where it will be reversible after bronchodilator use. Peak expiratory flow rate, which will show variability in airway obstruction. Methacholine challenge test, which will confirm bronchial hyperactivity. Methacholine challenge test. Lastly, we have allergy testing, which identify the triggers. In terms of priority drugs for treating, we could use the short-acting beta-2 agonists like salbutamol for immediate bronchodilation. We could also use long-acting beta-2 agonists like salmeterol for long-term control of asthma. We could also use inhaled corticosteroids like budesonide and fluticasone to reduce inflammation. We could also use leukotriene receptor antagonists like montelukast to prevent inflammation. And lastly, we can use systemic corticosteroids like prednisolone for severe exacerbations. As for coagulation disorders and DIC diagnosis, we have hemophilia type A, which is deficiency of factor 8 leading to prolonged bleeding. Hemophilia type B, which is also referred to as the Christmas disease, will lead to deficiency of factor 9. Von Willebrand's disease, which is deficiency of von Willebrand factor affecting platelet adhesion. Then we have disseminated intravascular coagulopathy. This is widespread clotting and bleeding due to coagulation activation. Lastly, we have liver disease-associated coagulopathy, which is impaired clotting factor synthesis due to liver dysfunction. 5 diagnostic tests for DIC, disseminated intravascular coagulopathy. We could have prothrombin time, PT. So this one will be prolonged due to consumption of these clotting factors. Activated partial thromboplastin time, APTT. This one will be prolonged due to factor depletion. Fibrin degradation products, the FDPs, they will be increased due to fibrinolysis. The D-dimer test will be elevated due to fibrin clot breakdown. And lastly, we have the platelet count, where we're going to have decreased due to excessive consumption. For the bronchiectasis, we could have diagnosis like infective airway clearance related to thick mucus production, impaired gas exchange leading to mucus plugging, bronchial deconstruction, and we have infective breathing pattern related to chronic respiratory distress, risk for infection related to retained secretions, and activity intolerance due to hypoxia and fatigue. Pathophysiology of bronchoectasis, we could have chronic inflammation from infections such as TB, pneumonia, which leads to damage of the bronchial walls. So destruction of the elastic and muscular components leads to abnormal permanent bronchial dilation. And mucus clearance will be impaired, resulting in recurrent infections and chronic productive cough. Persistent inflammation will lead to progressive respiratory dysfunction and possible respiratory failure. Diagnosis of bronchoectasis, we could do chest x-ray that will show bronchial thickening. High resolution CT scan. This is the gold standard for detecting bronchial dilation and mucus plugging. We could do sputum culture to identify the causative agent, like for the case of Pseudomonas aeruginosa. Pulmonary function tests may show obstructive pattern with reduced forced expiratory volume in 1 second. Bronchoscopy will help assess airway damage and rule out malignancy. As for the case of collaborative management of bronchoectasis, we could do the antibiotics like ciprofloxacin and amoxicillin clavunet, that's augmentin for the infections. Number two, we could do airway clearance techniques like the chest physiotherapy, the postural drainage. Number three, we have the bronchodilators like the SABAs, like the salbutamol or the SAMA, like the ipratropium, and this will help relieve airway obstruction. Next, we have oxygen therapy for hypoxia management and surgical intervention lobectomy for localized and severe disease. As for the anemia and CBC components, you could looking at now at the 5 types of anemia. You could talk of iron deficiency anemia. This is due to inadequate iron intake or blood loss. We'll have pernicious anemia. This is vitamin B12 deficiency due to lack of the intrinsic factor. Aplastic anemia, this is bone marrow failure leading to pancytopenia. Hemolytic anemia results from increased RBC destruction, like in the case of sickle cell disease or the glucose C phosphodiesterase enzyme deficiency. Chronic disease anemia could be associated with chronic infections and inflammation. Lastly, we look at the components of a CBC report. So the components of a CBC report include number one, hemoglobin, which measures oxygen carrying capacity, hematocrit, which measures the percentage of RBCs in the blood, red blood cell count, which measures the total number of erythrocytes, mean corpuscular volume MCV, which measures the average sizes of RBC, MCH, that is mean corpuscular hemoglobin, average hemoglobin in a single RBC, the mean corpuscular hemoglobin concentration, MCHC. This one measures the concentration of HB in RBCs. White BC count, this one measures the total number of leukocytes. Differential white BC count, this one measures the breakdown of different white BCs like neutrophils, how many, the lymphocytes, cynophils, and so on and so forth. We also have the platelet count, which measures thrombocyte involved in clotting, and the red cell distribution with RDW, which measures the variation in RPC size. So friends, those are some of the questions that were tested in that period. You can look at those questions. If you find the content useful, please remember to share with your friends so that they can keep on supporting our channel. Thank you so much. See you again.